You know, a lot of times you'll see people on TV who have undergone extreme plastic surgery in a kind of a quest to turn back the hands of time. But our next guest says the reality is a lot of average people, just regular folks like you and I, want to do just some little things to feel better about themselves. It's really about feeling good about yourself inside and outside. Dr. Beth Collins is a double board certified plastic surgeon in general surgery and in plastic and reconstructive surgery. Thank you so much, Dr. Collins. Thank you so much for joining us today.
Oh, thank you. Thanks for having me.
You look absolutely beautiful.
Thank you.
I also understand that you're part of the 40 under 40 group. Tell us a little bit about what that is.
Well, I was nominated and elected to be a group of young individuals who came to Connecticut and started up businesses. It's been a great honor that they chose me for that.
And this is a whole thing that's done through Connecticut Magazine, right?
That's right.
Were you shocked? Did you have an idea you were in the running or what?
No, some patients actually nominated me. I didn't know until the letter came that I had been elected, and I said, what's this? And it was really exciting. So it's been a lot of fun.
Well, I have to tell you, this is a topic that's very close to my heart, because as I'm moving on through years, I've actually given it some serious thought myself. What is it? How do you decide, you know, who's a good plastic surgeon? We have seen some scary stuff on TV recently, that even some stars that don't look like they used to look. How do you decide the right plastic surgeon?
Well, the safest and best thing that you could do first, and really the baseline, is to make absolutely sure that the person that you're going to is a board-certified plastic surgeon by the American Board of Plastic Surgery. There are other boards that have popped up that don't have as stringent criteria. So when you have a surgeon who's been board certified and nominated by the American Board of Plastic Surgery, you could be sure that they've done a full surgical residency for years, getting hands-on experience, being mentored by some of the leaders in plastic surgery in our country. And then they go through a stringent testing session where you do a written test, and you're critically evaluated by your mentors and your peers to make sure that you're really good at what you're doing. And the only way you know that your person has gone through that is if they have that seal from the American Board of Plastic Surgery. Anybody else may not have gone through such training.
Now here's a question. What about, does the type of plastic surgery you wish to have on different parts of your body or whatever, does that have a lot to do with the kind of plastic surgeon that you choose to do your procedure?
Sometimes. There are people who specialize in different types of procedures. So one person may have a specialty interest in doing eyelids. Somebody may be more akin to doing rhinoplasty. When you're trained in plastic surgery, you do get a full complement of everything within the field, but people do tend toward certain procedures. So you could ask your surgeon that. You have to make sure that when you choose your surgeon, you ask to see their results. A plastic surgeon, or a good plastic surgeon, will have before and after photos to show you. They should be very proud to show those to you. So make sure they have that, and see what their experience is. Ask them.
Okay, now what kind of benefits do you see from your patients that have gone under, you know, some sort of, you know, cosmetic or reconstructive surgery?
Well, the obvious benefits that they look better.
Yeah. And they feel better.
They absolutely feel better. I mean, it's kind of a new confidence booster. I see people feeling just a little bit happier about the way they look, which really changes every aspect of the way they feel, how they interact with other people. It really is a nice thing.
All right, what about some of the procedures that are offered at your offices, different types that you offer?
I'm a full-service plastic surgeon. I do have a special interest in doing eyelids and facial rejuvenation. I did an extra specialty fellowship in breast and body contouring, which is breast augmentation, reductions, even reconstruction for cancer, tummy tucks, all those things. So I have a proficiency in those types of surgeries. Also in my office, I do, for people who don't want to have the downtime of surgery, I do non-surgical things like Botox fillers, just for freshening up the look without going through a major surgical procedure. So we really do everything.
Real quick, what's the basic difference between a cosmetic surgeon and a plastic surgeon?
Well, that goes into the board certification.
Okay.
So when you have a plastic surgeon, you know that person has gone through a surgical residency, has gone through the testing. With a cosmetic surgeon, that's not necessarily so clear. Somebody who is a cosmetic surgeon may not have even done a surgery residency, actually. It could be a dermatologist who spent a year watching a cosmetic surgeon. It's really a mixed bag when you're talking about a cosmetic surgeon versus a plastic surgeon who's been board certified by the American Board.
All right, here in Connecticut, what would you say are the most popular things that people are requesting right now when they come to your office?
It's sort of changing now. I've been seeing a lot of minimally invasive things like the Botox and fillers, but the most common things people are asking for now are liposuction. I get a lot of breast augmentation requests and a lot of facial rejuvenation, eyelids and that kind of thing.
I understand med spa just became part of your practice. Explain
That's
that
right.
connection. That's kind of interesting.
Well, I just opened a med spa where I have a wonderful esthetician who's very skilled in medical grade facials like chemical peels and dermabrasion, and you have to start by taking care of your skin. It's a holistic approach to keeping yourself looking fresh and youthful. So.
Right. Can I chat with you a little bit out in the hallway? Okay. Hey, if you'd like more information about Dr. Collins, this is the way to go. She's located in Guilford. Call 203-689-5295 or check out the website at bethcollinsm.com. Is that right?
MD.com.
MD.com. I did that great. Beth Collins at MD.com. All right, check it on the screen. All right, for more information, you could also go to WTNH.com and click on Connecticut Style and find out all about that. Thank you, Doctor.
Thank you.
All right, up next, our kitchen is overtaken by the LaBarbera family. Wait till you see this. Teresa and her family share a Mother's Day recipe when Connecticut Style returns.